Temporal arteritis is a type of vasculitis, which is an inflammation of blood vessels. It affects the temporal arteries, which are the blood vessels that run along the sides of the head, just above the temples. It is also known as giant cell arteritis, and it mainly affects people who are over 50 years old. It is more common in women than in men. Temporal arteritis can cause severe headaches, scalp tenderness, jaw pain, and vision problems. It is a serious condition that requires immediate medical attention. If left untreated, it can lead to blindness or stroke. The exact cause of temporal arteritis is unknown. However, it is believed to be an autoimmune disorder in which the body's immune system mistakenly attacks healthy cells and tissues in the arteries. Genetic factors may also play a role. The symptoms of temporal arteritis can vary from person to person, and they can be subtle at first. The most common symptoms include 1. Headaches. These are usually severe, throbbing headaches that occur on one side of the head. The pain may be constant or come and go. 2. Scalp tenderness. The scalp may be tender to the touch, especially around the temples. 3. Jaw pain. Chewing or talking may be painful, especially on one side of the jaw. 4. Vision problems. Temporal arteritis can cause a variety of vision problems, including blurred vision, double vision, loss of vision in one eye, sudden vision loss. 5. Fever. Some people with temporal arteritis may develop a low-grade fever. 6. Fatigue. Many people with temporal arteritis feel tired or weak. 7. Weight loss. Some people with temporal arteritis may experience unexplained weight loss. Diagnosing temporal arteritis can be challenging, as the symptoms can be vague and nonspecific. However, there are several tests that can help confirm the diagnosis. On physical exam, your doctor will examine your head, scalp, and temples for signs of inflammation or tenderness. A blood test is often performed that can measure the level of inflammation in your body. Elevated levels of certain proteins, such as C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, can indicate temporal arteritis. If there is a strong clinical indication, a biopsy of the temporal artery can confirm the diagnosis of temporal arteritis. This involves removing a small sample of the artery and examining it under a microscope for signs of inflammation. The goal of treatment for temporal arteritis is to reduce inflammation in the arteries and prevent complications. The most common treatment is a high dose of corticosteroids, such as prednisone. This medication can quickly reduce inflammation and alleviate symptoms. However, corticosteroids can have side effects, including weight gain, mood changes, and an increased risk of infections. Your doctor will carefully monitor your treatment and adjust your dosage as needed. If you have vision problems as a result of temporal arteritis, your doctor may refer you to an ophthalmologist for further treatment. In some cases, surgery may be necessary to repair damage to the arteries or to prevent complications. There is no known way to prevent temporal arteritis. However, early diagnosis and treatment can help prevent complications and preserve your vision. If you experience any of the symptoms of temporal arteritis, it is important to seek medical attention right away. In conclusion, temporal arteritis is a serious condition that can cause severe headaches, vision problems, and other symptoms. It is more common in women over 50, and it is believed to be an autoimmune disorder. Early diagnosis and treatment are critical to prevent complications, such as blindness or stroke.